We're for sharing innovative treatments and preventing disease before it ever develops. Learn how our team is working to better care for you on this edition of UVA Health System Radio. Here's Melanie Cole.
Approximately 1/3 of patients with depression don't respond to standard treatments. When should you consider alternative treatments for depression? My guest today is Dr. David Hamilton. He's a board-certified psychiatrist whose specialties include TMS therapy for depression at UVA Health Systems. Welcome to the show, Dr. Hamilton. So what are some of the standard therapies that you prescribe for depression that generally the population would hear about?
Well, sure. I think the mainstay of the treatment of depression is really twofold. It's medications on the one hand, and there are a variety of medication classes of antidepressants and other classes of medications that we use in addition to antidepressant medications that have been shown to augment their response. And then the second thing would be psychotherapy, and the literature the science has shown that with regards to medications and psychotherapy, both are useful, but really the whole is greater than the sum of the parts. They tend to work better together.
Okay, so when does it come down to trying other treatments? How do you know that these standard course of treatments together separately are not working for someone?
Well, the patients that I see in the treatment-resistant mood disorders clinic here at UVA are patients that have tried a variety of treatments, both a number of different medications in different classes, and as well as psychotherapy. And they either are not responding or they're having an incomplete response that is still leaving their lives not functioning in the way that they want to.
Okay, so then what? What's the first course that you would look at as complementary medicine?
Well, I think the first thing that we do is make sure that the person has tried medications that are appropriate to the symptoms that they are experiencing. Not all antidepressants are created equal, and not all depressions are the same. Some patients have depressions where anxiety is a huge component of their depression. And other patients have depressions where they just feel like they can't get out of bed and they have a lack of energy. And matching the appropriate antidepressant medication to the symptoms that a person is experiencing is job number one. Now, if that's been done and a patient has still failed to respond to a good trial of medications, but then we start to look at techniques like TMS, which stands for transcranial magnetic stimulation.
Tell us what that is.
So we are beginning to understand primarily through the advances in neuroimaging, the different parts of the brain that are in control of our mood. And we know that primarily mood is something that exists very deep in the brain, so it's very hard to access. However, there are areas on the outside of the brain that, the newer parts of the brain, if you will, that are control centers for those deeper parts that we can't access. So TMS allows us to target those areas to improve their functionality and their ability to control the deeper emotional parts of the brain.
That's fascinating. So how often does someone have to have a TMS session?
Well, a group of sessions is every day. One session lasts for 37 minutes. So it's pretty brief, but it is a commitment because it's Monday through Friday for 4 to 6 weeks. And then we do a taper there'll be 3 sessions a week for a week, then 2, then 1. So it is an investment in time.
And then does this work in the long term, doctor? Is it something that they have to keep redoing? How does that work?
Well, there's been a variety of responses. We generally, people don't need to keep getting sessions. Sometimes if people begin to experience the symptoms of depression again, then we'll do an abbreviated course. We'll do a few sessions to sort of touch them up, and when they begin to respond, then we'll stop. And very rarely, sometimes people need a complete course again if they're having another full-blown major depressive episode.
So how do you work with patients, doctor, about other kinds of remedies for depression, maybe mind-body therapies, cognitive behavioral therapy, exercise? Where do you include all of those?
Sure. So when I'm working with a patient, I really, in developing a treatment plan, I think of it as, and the metaphor I often use is that of a chair having four legs, and each leg is important. First leg is medication, but that's not I think very often people want a pill that's going to fix everything, and very rarely is that the case in depression. But medications are an important part of treatment. The second leg of the chair, if you will, is psychotherapy. And there, as you mentioned, there are a variety of different kinds of therapy. Cognitive behavioral therapy, psychodynamic therapy, that's the more sort of classic long-term insight-oriented therapy. Short-term therapy that's focused more on developing specific coping skills. The third leg or pillar of a treatment plan is the things that we put into our body. So that includes diet as well as substances, alcohol, drugs, both illicit and licit. In addition to things like vitamins and nutraceuticals that we know are helpful in treating depression. And finally, and certainly last but not least, is exercise. Exercise is as important as any other aspect of a full treatment plan. Of course, when somebody is in the midst of a full-blown depression, it can be cruel to say, well, just start exercising. So very often it's the job of the medications and therapy to get people to the point where they can start having a lifestyle consistent with recovery from depression.
Such great information. In just the last few minutes, Dr. Hamilton, why should patients choose UVA for their psychiatric care?
Well, I think UVA, we have the advantage of being inside of a large university system, and we're able to bring all of those resources to bear. So rather than being just a TMS clinic, we're able to really take a look at patients as individuals and decide what is the appropriate course of treatment for this particular patient. It may be a TMS or some other kind of treatment modality is appropriate, but we're able to really customize and individualize treatment plans based on the individual needs of a patient. So we're more, I think, patient-focused than focused on the clinician and what we happen to have to offer, since we have so many different modalities to offer.
Thank you so much. It's great information. You're listening to UVA Health Systems Radio. And for more information, you can go to uvahealth.com. That's uvahealth.com. This is Melanie Cole. Thanks so much for listening. Thanks so much.